When Texans vote tomorrow, a big issue for them will be health care. Texas has the highest number of uninsured Americans in the country, nearly 1 in 4. For those living on the border, it's even higher, more than 1 in 3. Our national correspondent Byron Pitts reports that's leading some to look south for help.
It's degrading.
That's Rosie Perez, a U.S. citizen born and raised in Texas. We rode with her to see her local pharmacist in Mexico.
Está bueno. This box would have cost me $100.99 in the U.S. I'm getting it from the Mexican side for $27.
The exact same bottle?
Yeah.
And we heard similar stories time and time again from other U.S. citizens who crossed the Texas border into Mexico.
$3.99, give me 4.
For their prescriptions, doctor's visits, dental care, even surgery. People from as far away as Iowa, Minnesota, Illinois.
The healthcare system in the United States is a travesty.
Jana Jones is a truck driver originally from Dallas. Like 47 million Americans, she has no health insurance. Her choice, live within driving distance of Mexico.
I can come over here, I can get an x-ray for $25. I can buy my prescriptions for about 60% less than I would have to pay for in the U.S.
For Rosie Perez, the dark reality is this. Healthcare in Mexico is her only affordable choice. A diabetic, she lost her job at a windshield wiper plant 6 months ago. Try as she may, few if any employers in Brownsville are hiring full-time a 46-year-old with a pre-existing medical condition. Her doctor of 4 years will no longer see her.
Suddenly you lose your job, you lose your health care, and they don't remember you.
From Rosie's house in Brownsville, Texas, across the border into Matamoros, Mexico, it's a 20-minute drive into a sea of pharmacies, medical offices, and a huge savings. For her, a doctor's visit back in the U.S. will cost $125. Here in Mexico, $3.
We asked the Clinton and Obama campaigns how their health care plans would help someone like Rosie. Both call for universal health care.
I'm not ready to leave anybody out.
Under Clinton's plan, a person like Rosie who has virtually no income would receive government-subsidized health insurance, but she would still be required to pay a small copay. And Clinton's plan could lower Rosie's prescription drugs by up to 40%. How? By allowing the reimportation of prescription drugs from foreign countries.
I've proposed a health care plan that anybody can access.
Under Obama's plan, he'd raise the federal poverty line, which would make Rosie eligible to receive Medicaid with a zero or small copay. Last year, Rosie made $12,000. Also, Obama's plan would allow the government to negotiate with drug companies for a lower price, which would help reduce Rosie's prescription cost. But critics caution neither is a silver bullet.
If you're mandating or you're obligating people to purchase a policy that they cannot afford, then that's not going to work in an area like this.
Because people will always go back to Mexico.
People will always have that option of going to Mexico to get health care.
People like Rosie Perez.
Oh, I can get health insurance from a private agency, which will cost me $389 a month.
How much money do you bring in a month now?
I would say about $400 working odd jobs.
We asked Rosie which health plan she preferred, and she said neither. Katie, there's still plenty of skepticism down here, no matter who becomes president.